I'm Dr. Santosh Kumar. I'm a consultant nephrologist and a transplant physician. This World Kidney Day is falling on 10th March, Thursday. So let us try to keep our kidneys healthy as much as possible. What can we do to prevent kidney disease? As of now, what we are more concerned is having a proper healthy lifestyle. That is having a good diet, and if you are a diabetic or a hypertensive, any of the other comorbidities, any of the organ diseases, if you are having it, if you have some other problems for which you are taking chronic medications, consult your doctor whether it's going to affect your kidneys or not. I have a habit of taking painkillers or any other medicines for a longer duration. Have to look into whether their kidney is functioning properly or not. At the same time, if you are a diabetic, keep your sugars under control. If you are a hypertensive, see that your BP is also under control. How do we know whether our kidneys are functioning properly or not? First thing is to check for kidney function test. Simple test known as serum creatinine will pick up whether your kidneys are normally functioning or not. At the same time, you should also see whether your urine is also normal. So complete urine examination and RFT or serum creatinine is itself enough to screen for any other abnormalities in the kidney function. What sort of signs and symptoms do you have to identify whether you have a kidney functioning? So as a routine, as I would suggest all my patients is if you have the risk factors to develop a kidney failure, that is apart from the diabetic, hypertension, if you have some sort of kidney failure previously, you had a kidney attack, or let's say you have been told that your creatinine is on the higher side, or you have a family history, there are some cysts in the kidneys, or kidneys are not normal in size and shape, or you have some sort of urinary abnormalities like repeated urinary tract infections are happening, or hereditary diseases are present in those events, or some diseases called as autoimmune diseases, so wherein there is a possibility that kidney will also get affected. Those individuals have to get tested to identify whether kidney is functioning properly or not. Are there any signs and symptoms to identify whether kidney is functioning properly or not? The first and the basic thing is whenever there is something called as increased frequency of urination. So as the kidney function starts dropping down, what happens is kidney's ability to concentrate urine comes down, so that way it leads to excessive production of urine. Whenever you have excessive production of urine, there is always a symptom of increased urination in the night, and there are other factors. It is simply divided. You can divide the kidney disease into two types. One is one which has a lot of protein loss in the urine, one which does not have. The protein loss in urine is the one which usually picks up, usually presents earlier, and it usually progresses a bit rapidly. So whenever you have protein loss in the urine, what you can identify is you have frothiness in the urine, a lot of bubbles are present when you are passing urine, and it's difficult to flush the bubbles. Last thing is there is also a slight hint of excessive weight gain which might be present if it is early onset, and there will be also a lot of fatal edema, swelling of feet can be present. In extremes of scenarios, whenever the kidney function has dropped to such an extent that it has less than 5% of kidney functioning is there, in those events you start seeing various other abnormalities. The other abnormalities which can be present are pressures which have started increasing, or if you are a diabetic with the same medications, your sugars start falling down, or in the extremes of scenarios where you are almost in a pre-dialytic stage, so dialysis indication might be present in a near future. In those events, you start finding that you start developing pruritus, that is a lot of itching can be present, or you might have shortness of breath, or there will be a kind of generalized weakness, generalized loss of appetite might be present, nausea, vomitings can be present. In the extremes of scenarios, there is even a chance of change in the sensorium as well. So as a last step, what I would suggest is maintain a healthy lifestyle and take care of any of your diseases. If you have properly, see that you don't develop any medication related kidney toxicity. Don't go for any other vague things which don't have any proven value, going ahead for herbal medicines or unproven therapies which might be advertised in any of the social channels or so, and see that you don't lose your kidneys at an early stage.